I love it. Well, we're live, so let's go. Hi, everybody. My name is Taryn Hyatt. I serve as our area director for the Utah chapter of the American Foundation for Suicide Prevention. Tomorrow begins the Utah State Legislative Session. So it is 45 days of really intense. The director for the Utah chapter of the American Foundation for Suicide Prevention. This is what happens when you go live. There's going to be some technical difficulties. So there you go. At any rate, this will be our 7th annual State Capitol Day, where we are going to be up on the Hill. This happens on February 23rd of 2023. And it's going to be a really exciting day. We have partnered this year with our friends at NAMI Utah. So again, our goal is to bring all the advocates that have passion and have been affected by both mental health, mental illness, and suicide. The State Capitol Day is an opportunity for you to meet with your legislator in person and share with them some of the asks that we will be prioritizing for this session. So while we will do a more in-depth training the day of and in preparation for, we will be sending out materials and bills that we're following and things leading up to this day. I did just want to jump on and give you a little overview of what you can expect at a State Capitol Day. So what you can expect and why do we do this, okay? AFSP has always prioritized advocacy efforts, starting back 2 decades ago with SPAN, the Suicide Prevention Action Network. And so you can go onto our website today, if you've not already, and sign up to become an advocate. Visit afsp.org/advocacy. And why is because we make a difference. Our voices collectively elevate the conversations around suicide prevention and mental health. We have over 46,000 field advocates across the United States, and collectively we can help to influence our policymakers and improve the access we have to care and prevention of suicide. In 2022, we engaged lawmakers all across the country with over 75 state suicide prevention and mental health bills that actually became law. So this is a picture of us last year at State Capitol Day. We were so excited to be back in person. You can attend a State Capitol Day in your state or even our annual advocacy forum, which will be, I believe, in person this year back in Washington, D.C., which is so exciting. And again, these are opportunities that AFSP provides for you to meet in person with your legislators, really be able to share your story about how suicide or mental health has impacted your life. And then again, ask for them to support the legislation that we are interested in that will help, or sometimes in opposition. Maybe there's some legislation that's being brought that could cause harm in our communities. So we help to advocate for both. So you can advocate virtually if you're not able to attend. Again, by signing up to become an advocate, we're going to keep you apprised of all the things that are happening, both at a national level and a local level. So you can take action through our Action Center. It helps you to email your federal and state officials in literally 2 minutes or less. You can tweet at them, you can share this with friends and family. And so it's a really great opportunity to stay engaged without having to leave the comfort of your home. And again, the importance of these days is really for you to learn who your reps are and start building that relationship. While yes, we show up on February 23rd and connect, we encourage you to connect with your lawmaker all year long. So the first thing you want to do is introduce yourself, share the connection to our cause. We offer to be a resource. We have a public policy team in DC and a local public policy team in our chapter, and we can help connect you to the support or answers to questions that your lawmakers may have regarding specific issues being brought forward. And again, if you don't know the answers, reach out to us. We'll help you. Again, we encourage you to build this relationship year-round, and you do that by emailing them. During the session, you'll want to make sure that you put constituent in the subject line. What this enables you to do is make sure that they know it's somebody that they represent. I also encourage folks to look up their legislators. I'll show you how in just a moment, and get their phone numbers. Give them a phone call, text them. Again, let them know that they represent you and what you're passionate about. Engage with them on social media. Try to be respectful. That's always a bonus, right? We want to make sure that we're being kind and again, offering support. We don't have to agree. Okay, there's many of our legislators I don't always agree with, but I'm willing to challenge them, but also be respectful to them when I engage with them. Again, you can make these visits virtually or in person. If you haven't already, attend one of their town halls or community meetings. Representative John Curtis is mine, and I've attended many of his town halls throughout the years. You can also subscribe to their newsletter. That way you get information of what they're up to and what they're voting on as well. And one of the things I've had the privilege to do, and we encourage our advocates to get involved, is to be able to testify at hearings. Again, you can do this in person. You can write letters, again, or verbally. Thankfully, due to COVID, we've been able to engage with our lawmakers and be part of committee hearings virtually through Zoom. So even if you're not able to get up to our Capitol in Salt Lake City, there still is opportunity for you to engage and be a resource. So this website is the best place to track the legislation and things that are happening, identify again who your people are, and find out their contact information. Visit le.utah.gov. Once you visit that site, you're going to see 2023 legislative session. Click on that. It'll highlight the bills that are already numbered. There's definitely more that will be coming. There's a few that we're tracking that I'll share here in just a second. But again, there's new bills being numbered daily. So I monitor those. You can track the different legislation if you're interested in getting updates. And again, learn more about the legislative process on our site. There's also a calendar that's published weekly, and you'll be able to see, excuse me, which committees are meeting, what bills are being heard, when our legislators have floor time, and so much more. So a couple of the bills that we're watching right now, there's two that we're concerned about, and these are ones that we're going to be advocating against because we know that gender affirming care can be life-saving for our trans youth. So both Senator Kennedy and Representative Shipp have brought forth bills that will ban any kind of gender affirming care for young people. This includes surgical procedures, but it also includes puberty blockers and hormone treatments. Again, our mindset here is that these kinds of decisions should be left to physicians and parents collectively to work together, that we shouldn't be legislating healthcare really for anyone, but especially for our youth. And also, we know that gender affirming care has been proven. There's research that supports it can be really life-saving. We know that young people who experience rejection, gender dysphoria, because they do identify as another gender than the one they were assigned at birth, benefit from engaging in affirming healthcare. Again, we're not seeking to put care onto anyone that is not willing and knows what they're going into. And I'll just encourage you to learn more about transgender healthcare. We'll help to give some education on it at our state day as well. But again, you meet these people and hear their stories. It's really impactful to see how having access to something like a puberty blocker in their teen years has been helpful as they move through their experiences. We also have a couple that we're really excited about and in support of. House Bill 59 is looking at first responder mental health benefits and making sure to extend coverage to the spouses of first responders. We know this is critical. Our first responders witness more than most of us ever will in a lifetime, and it does take a toll on their mental health. So we want to thank Representative Wilcox, Representative Karen Kwan. There's several legislators that have prioritized our first responders' mental health, and we appreciate that. And then Steve Ellison's always coming through with some really great bills. He's been an incredible champion for us, as well as Senator Dan Thatcher. They're both very passionate about mental health and creating systemic changes and ensuring that we have the behavioral health supports in place for when people are in crisis or trying to access care. So House Bill 66 will be wonderful. This is going to provide more funding for mobile crisis teams, for receiving centers, and then virtual mobile crisis teams so that we can, again, gain access to some of these tremendous supports in rural parts of our state. And then we're bringing back House Bill 78. We advocated for this last year. Unfortunately, it didn't have a chance to get through at the last minute. The session, as I mentioned, is fast. 45 days for a lot of legislation to be heard. But this one is titled Scott's Bill and is in honor of Dr. Scott Jolly, who was a physician that died by suicide after the pandemic. What this bill aims to do is ensure that, again, medical professionals can access mental health services outside of their insurance network. Those of you who have health insurance know that oftentimes we have to see people that are in network in order to cover services. But we know that a physician might not want their colleagues to know that they're seeking help. Again, we have a long way to go to break down that stigma. So this would allow for them to seek treatment outside of network and still ensure coverage. And then, as I mentioned, there's going to be a lot more to come. A lot of firearm bills will be discussed this session. Again, AFSP comes at the firearm discussion with, again, safety, right? We just want to ensure safe storage, that folks who own firearms are educated about the risks of suicide, and again, storing their guns safely. So there's a couple of bills that we'll be advocating for that encourage that safe storage. So just a quick little overview, for how bills become a law. Again, usually what happens is somebody comes to their legislator and has identified an issue, and then that legislator takes it up to their House of Origin. So whether that's the Senate or the House of Representatives. The bills are always introduced in committee hearings. And then in those committee hearings, there is opportunity for public comment. So this is really where we invite people to get engaged. Once the bills go to the floor, we don't really have an opportunity to testify at that point. We can be still writing to our legislators, calling them, emailing them, so that they can take specific action. But the committee hearing is really where we as the people have an opportunity to share our voices. Again, we will help keep you informed, but you can also find those committee hearing dates and times. Again, you can tune in live through Zoom by visiting le.utah.gov. So again, once there's been action on that bill, it will move to the opposite side. So again, if it was heard in the House, it will go to the Senate, have a committee hearing. If it passes both committee hearings, it's then introduced to the floor. And that's where the floor, again, the senators will vote, the House of Reps will vote. If both floors vote in approval, those things will move on. And then again, the governor can take action by either signing it into law, allowing it to be a law without his signature, or actually vetoing the bill. So pretty cool to see how this process works. And again, when we have our state capitol day, we love that folks get to attend and see, right? We go sit in on the committee hearings. We sit in on the galley and observe this discussion. So pretty cool to be a part of. And then again, there's a lot of resources that we offer. So we're going to provide you with training materials, priorities. Again, we'll pick probably 3 things that we're really focused on to highlight this session, but there's a lot of things that we'll be supporting or opposing depending on the nature of the bill. Again, our organization is dedicated to saving lives and bringing hope to those affected by suicide. So we really want to be mindful that the legislation our lawmakers are passing does that and helps to meet that goal. Again, there's a state and federal bill tracker that you can follow on our Action Center, as well as statistical sheets. So invite you to check out these different resources. They're very helpful. And then just last, I want to, and I'll make sure that we include this link. There is a blueprint for suicide prevention that was co-authored this year by the American Foundation for Suicide Prevention and the American Academy of Pediatrics. And again, this really highlighted the need for us to be more comprehensive in our youth suicide prevention efforts, specifically among marginalized communities. So our LGBTQIA youth, our kids of color, both in Black and Brown families, Latinx communities, Pacific Islander, Native American, we have seen, again, an increased risk and also a lack of resources for some of these communities. So it is our goal and intention to make sure to address these. And again, you can Google, I forgot that this link isn't clickable for you all in this version, but Google Blueprint for Youth Suicide Prevention, and it'll bring up the document. This is a great resource to see collectively, nationwide, what supports are out there as we engage in this effort. So again, just want to thank you for tuning in. Hope to see you on February 23rd. You can visit our website to sign up, afsp.org/Utah. And again, it's our state capitol day. Please share. We would love to have that rotunda packed and full. All the details about our day of can be found on our website, and we look forward to joining. Take care, and we'll talk with you all